Good evening, everyone. My name is Zana Wangari Kiragu. I am a research fellow and a Doctor of Public Health candidate. And I'll give this similar disclaimer to Lawrence. I am from the continent, born and raised in Kenya. Today, I will be speaking on behalf of my colleagues' work that we are engaged in together as part of a Fairer Partnerships in Global Health working group. And so to start off, I hope this is visible. This is a map that's on the department, one of the department's notice boards. And so as the Department of Global Health, we have extensive networks across the globe. The blue pins denote countries where we have projects, and the red pins denote the origin of our department members. So one of the things that comes with working across diverse cultural contexts is we are naturally prompted to reflect on how we go about engaging our partners. And this introspection is vital to ensure that we have sustainable relationships and that we are continuing to meaningfully and equitably serve the populations that we are seeking to support through our research and teaching and practice. So we do know that power asymmetries exist in the context of global health, whereby we are seeing that across the various actors involved, we have an equal distribution of resources, and that may include money, knowledge, and political authority as well. Recognizing this as a department, a group of faculty and staff work together to form the Fairer Partnerships in Global Health Working Group. And here we are in alignment with and support of the efforts across the globe to decolonize global health. And we are also working in alignment with requirements that we're increasingly seeing from funders to demonstrate or provide evidence that we are ensuring equity in our partnerships as we make our research, as we submit our research proposals. So some of the key objectives of this group include first, providing a space to initiate the conversations on this topic, and then developing recommendations collaboratively that can guide our self-study as we go about thinking, teaching, and practicing global health and public health, and also motivating beneficial changes towards shifting towards power symmetries in our practice. And as a group, we've undertaken various activities with the view to ensure that we are having mutually beneficial and sustainable partnerships with our colleagues in Africa and beyond. And some of these include listening sessions with our partners on the continent, where we sought to understand their experiences working with us and working with other Global North institutions. And from these listening sessions, we gleaned that capacity building was a key theme that emerged, and we've taken that a step further and tried to examine more within our department through listening sessions with our faculty what capacity building has looked like as they go about establishing their partnerships and undertaking their research. And when we say capacity building here, we're thinking about it from a reciprocal learning perspective, where our partners have things to learn from us and we also have things to learn from our partners. And so these listening sessions that we're having are being synthesized for shared learning in the department to ensure that we are practicing equitably as we go about sustaining and building new relationships across the continent. We have also had a roundtable discussion with students at the School of Public Health to understand what their learning needs are as it pertains to fairer partnerships and decolonization of global health. And recently, we got funding to take that a step further and develop a toolkit to support students in their education on this topic. So as we go about thinking about fairer partnerships, this work is in alignment with the evolving field of global health, which does have colonial origins and then shifted to a framework which was more of wealthier countries helping countries with less, which was pretty much a savior mentality. And now we are thankfully in this space of collective action. So we are trying to think about shared risks and responsibility and working collectively towards advancing global health for all. So as I mentioned, this is work we're doing as a group, and we have our website if you want more information. Thank you very much, and I look forward to discussing further.